CAD is serious and typically requires some real lifestyle changes to help reduce the risk of it getting worse and ending in a heart attack. The first step is knowing whether you have CAD and how far it has progressed. Diagnosing CAD starts with an initial exam where your doctor will review your general medical history and take some routine blood tests. Then your doctor may recommend more tests. Some tests may have to be done by a cardiologist. One very common test is called an electrocardiogram, sometimes called an ECG or EKG. This measures the electrical activity of your heart. Another test is a stress test. This is essentially an EKG taken while you're exercising on a treadmill. Your doctor may also order a coronary angiogram, also called arteriography or cardiac catheterization. Dye is injected into the heart through vessels, and then x-rays are taken to reveal the narrowed areas. Finally, there are other tests that produce 3D images of your heart. If your doctor does find that you have coronary artery disease, there are a number of treatment options depending on the severity of the disease. Many people are able to manage CAD with lifestyle changes and medications. However, people with severe CAD may need coronary angioplasty or bypass surgery. But the single most effective way to prevent or stop CAD progression is to start making healthy choices. First, don't smoke. Quitting smoking dramatically lowers your risk of a first or second heart attack. Next, manage your weight and eat a heart-healthy diet. That means lots of fruits and vegetables, whole grains, lean protein, and low-fat dairy. Avoid fast food and processed foods, which tend to be packed with sugar and bad fats like saturated and trans fats. And watch cholesterol intake too. High blood cholesterol is another primary risk factor for atherosclerosis. It's especially important to keep your cholesterol low after a heart attack to help lower your risk of having another one. Control your blood pressure. Have it checked at least every 2 years. Your doctor may recommend more frequent measurements if your blood pressure is higher than 120/80 or you have a history of heart disease. Your risk of CAD rises significantly with increasing blood pressure. If you're overweight, losing weight can help you further lower your blood cholesterol and blood pressure. Exercise routinely. Even moderate amounts of physical activity, 30 minutes a day, can lower your risk of death from coronary artery disease. Exercise helps decrease the inflammation in the arteries and helps control cholesterol. However, people with severe coronary artery disease may need to restrict their exercise somewhat. If you have coronary artery disease, check with your doctor to find out what kinds of exercise are best for you. Stress can also increase the risk of heart disease. To lower your risk, rethink your workaholic habits and find healthy ways to deal with stressful events and anger in your life. I know it's not easy, but it's so important for your heart and overall health. Get regular medical checkups. Some of the main risk factors for coronary artery disease, high blood cholesterol, high blood pressure, and diabetes, have no symptoms. CAD itself may produce no symptoms, but your doctor can perform tests to see if you have these conditions. And if a problem is found, you and your doctor can manage it early to prevent complications.